Hello and welcome to our new technology, the Angioscan, which is a perfect complement to those who are using the advanced heart rate variability system. And I'm real excited to share this with you today, as long as this goes to the next slide. There we go. All right, this is important as well. The Angioscan is an informational tool only. Final diagnosis is the sole responsibility of a licensed practitioner. So this is also a research and informational tool for you. Okay? Now, this is what it looks like. Real simple. You put your index finger in and get a reading. And what kind of reading are we looking at? We're looking at something called pulse wave type, which is an A, B, or C type of wave, and we'll talk about that. It measures heart rate. It measures vascular stiffness, which is how, this one of the large arteries, and also vascular age, which is measuring the stiffness of your small and medium vessels. Similar to our heart rate variability, it gives you a score on something called the stress index, which is similar to what we see in heart rate variability. And then we also measure oxygen saturation. So there's a lot of research on PPG is what this is called. And this is from Cardiology Review. We're looking at it in its use for measuring cardiovascular disease and the stiffness of the arteries. There's another article. This is a great article on the PPG and its application in clinical physiological measurements. This is an indication, this is showing you all different ways to use the PPG, and they use it for measuring oxygen saturation, the vascular stiffness, and a lot more. So it's just a great article to look at that and see all the different applications it can be used for. And it's also used in novel ways as well. This is used in cardiovascular assessment in patients with Raynaud's phenomena and systemic sclerosis, and there's a pilot study. There's a lot of research on using this technology, so I just thought I'd put a couple in there for you. So we're looking at this device as an estimate of your large artery stiffness from the pulse wave form obtained at the finger using an infrared sensor. The speed at which the pulse wave travels along the arterial tree is directly related to the arterial stiffness. So what it's doing is when your heart contracts, it sends a pulse wave, a pressure wave, down the vessels to the periphery, and then it has to return back. If that pulse wave returns back too fast, which we can measure, it's pretty much telling us that the artery is very, very stiff, like a pipe. So again, measuring the time it takes for the pulse wave to travel through the arterial system provides a simple but accurate way of measuring arterial stiffness. The shape of the volume waveform in the finger is directly related to the time it takes for the pulse wave to travel through the arterial tree. To get an accurate assessment, make sure, this is important, to put in the patient's height measurement. You know, when you first punch in all the patient information, it's going to be there for you, and that height is very important to measure that with your patient, so you can calculate, the machine will calculate out the stiffness of the artery. So measuring pulse wave analysis, it's kind of not new. It's been around for thousands of years. The Chinese have used it to measure the pulse wave. As you can see, this Chinese physician measuring the radial artery, he's measuring the pulse wave, which gives him information about the whole body, about what's going on in those meridians, those energy meridians running through the body to the specific organs, and he's looking at a total approach to health, measuring that pulse wave. But he's measuring it with his senses. Later on, we developed ways of measuring, instead of measuring with our senses, being able to observe it and see visually what's going on with the pulse wave, and that's what we're going to do. So we're going to be able to detect the condition of your vessels. Are they working properly to maintain health, or are they moving towards a disease state? And so visually, we can see that, and it started this kind of technology started in the 1800s with this gentleman, Frederick Akbar. And in 1867, at the age of 18, he began to study medicine at Sussex County Hospital in Brighton. 2 years later, in October 1869, he entered Guy's Hospital, London, as a medical student. He was an outstanding student, and in 1871 he won the Student Pupils Physical Society Prize for his work on sphingomammogram, is what this thing is called. And he gained his MD from the University of Brussels in 1875. He was really kind of an interesting, kind of Renaissance guy. He fenced and he taught boxing, and he went into the medicine, and he developed this technology to measure the pulse wave, which we'll talk about. And there's a lot more on him because he did a lot of work on blood pressure. He described the characteristic features of the pressure wave in patients with high blood pressure and in persons with atherosclerosis. I mean, this is in the 1800s, and it's pretty amazing. And this is what it looked like. You know, this is the visual, because once he had the person's hand here, and this was on probably the radial artery, and he could visually see this on this smoky paper here, this waveform. And by studying these waveforms, he looked at these consistent pathognomonic patterns that he saw over time that corresponded to very specific diseases. I think this is just amazing work. And then later, this other homeopath came along, Dr. Robert Ellis Dudgeon, and from 1820 to 1904, and he kind of refined the technology a little bit, as you can see here. And with the disappearance of, unfortunately, to the demise of Frederick Akbar, the disappearance of the waveform, well, it just disappeared, because, I'll tell you why it disappeared, because in 1860, the discovery of the stethoscope, and also in 1905, the description of the Karakoff sounds and the first measurement of blood pressure with the sphingomanometer, it kind of, that took over. We were able to measure blood pressure using this technology, and doctors opted for simplicity over accuracy. So the disappearance of the pulse waveform, it just disappeared, and this shaped the way we did medicine for the next 100 years. So poor Frederick Akbar. So now, over 1 million people worldwide currently have elevated blood pressure, and over 500,000 more will have the silent killer by 2025. So we got to have a way to prevent these problems way before they become something deadly. So, you know, when we look at cardiovascular disease, if we're looking at this continuum here, and we're looking at clinical events down here where somebody has a heart attack, an MI, we need to be able to get to them, be able to see patterns way before they get over here. Now, a lot of patients are coming in now and they're doing the carotid artery ultrasound, looking for the thickness in the arterial wall, or they're doing getting a calcium score, and they're coming in with their calcium score and saying that they have calcification in here, and da-da-da-da. But really, do we want to wait till something happens over here? If we're getting closer over here, we want to catch problems way over here early on, where the endothelium, where we start to see endothelial dysfunction, and we'll talk more about that in future updates. But so we want to catch the problem way out here. That's the bottom line, and we're going to do that using pulse wave analysis, and these are the pulse wave types we're going to be looking at. And we're going to look at the C, which most of us want to be. We're going to look at the B pattern and the A pattern. So the C-type wave pattern is typical for subjects younger than 30 years without the risk factors for cardiovascular disease associated with atherosclerosis. The B-type wave pattern is typical for subjects older than 40 years or for younger persons with risk factors for cardiovascular disease. And the A-type wave is typical for subjects older than 55 years or for younger persons with increased arterial stiffness and high tone of the small resistive arteries. So that's basically what they are. And in your machine, most of us have a combination of these, but it's going to tell us which one we have the most highest percentage of what type of wave pattern. So So when we look at these things, we're looking at two orange lines, this one and this one. The left line is the systolic peak, which is right there where my arrow is. And the right is the return wave that I talked about, right there. If the returning wave is lower than this systolic peak, then it is a C wave pattern. So here it is, we follow this curve, you see this curve going up and down, this wave pattern, and this is right at the peak of it. That's the systolic peak. This is the returning wave right here. As we're going up, it's right there. This means the returning pressure wave is returning much slower and indicates a more flexible artery and a healthy aorta. With this wave pattern, you will see a negative number on the stiffness index and a lower CASP, which stands for central aortic systolic pressure. That's the pressure that's in the aorta, not at the brachial artery where we measure most blood pressure, but where it counts, up in the aorta, the big vessel. Okay? Now what we see when we see a C pattern, you can see this green line, and then we want to keep this line out of the red zone here. And it's telling us what this particular person's vascular stiffness is. His is a negative 23.9. There's very little pressure, very little stiffness when we get that negative number. That's what we want to see. And it says down here, stiffness index is less than normal values corresponding with good conditions of artery walls. And the number here is 50.0%. And that's for somebody his age. He is a lot less than that. He's doing really good. This is a great pattern. This is what we all want to see. And there it is. That's what it's going to look like on your screen. And there's the pattern. There's your systolic peak. The returning wave is right here. And the C wave is typical for younger subjects in the age of 18 to 35 years with normal elasticity of the arterial walls. This is the V pattern. You can look at that. They're kind of, here's the systolic peak here, and here's the returning wave on this side. In the B pulse wave, the returning wave is equal to the systolic peak, and the vascular stiffness will be equal to 0. That's your B pattern. And here's the A pattern. If the returning wave is higher than the systolic peak, the CASP will be much higher, so there's much more stiffness in the big artery. Okay, and so what we'll see here in this one is here's your on this side is your systolic peak right here, but way right on top is your returning wave. It's coming back too fast. So if the returning wave is higher than the systolic peak, the CASP will be much higher than the systolic blood pressure, and the stiffness index will be a positive number, which it is here. It's not a negative one like we saw before, it's a positive number. But even though it says here this 50% is the normal vascular stiffness for this age, this person is 17.9%, and it's much better than what is the norm for this age, even though he has an A pattern. This is the CASP. Central aortic systolic pressure is the pressure at the root of the aorta, or the largest artery in the body. The CASP is the strongest independent indicator for strokes, heart disease, and the survival rate, more so than the brachial pressure that everybody measures with typical blood pressure measurements. Now, I highly recommend everybody read, there's a study called the CAFE study, where they took people who had high blood pressure, hypertension, they put them on calcium channel blockers, one group, another group was on beta blockers, and both of them worked to reduce the pressure at the brachial artery. But they also measured, using very sophisticated technology, putting a probe up through the femoral artery into the aorta, and they measured the pressure at the aorta. And only the beta blocker did not work to reduce the pressure there. It wasn't significant enough, it wasn't good enough to do that. Calcium channel blocker did that. But the point being is that a lot of people have a false, they're taking medications, they're getting their blood pressure measured at the brachial artery, and that isn't really, I believe from the research, significant enough of a test to lower what's more important, which is the CASP. So the stiffness index represents the average pulse wave velocity in the aorta and its branches. The parameters are calculated from the ratio of the length of the aorta to the time interval between the systolic peak of the direct and reflective pulse waves. This index calculates well with pulse wave velocity. So it was shown in a large prospective study that an increase in pulse wave velocity is significantly associated with an increased risk of total and cardiovascular mortality in the elderly. So here's our test. First screen, this person's 59 years old. His blood pressure, his pulse, his heart rate is 67 beats per minute. His vascular stiffness is very, very good. He is, you can see here that he's really at the beginning of this line, this green line here, this vertical line, and it's saying that he has a negative 23.9% vascular stiffness. We'd love to have those negative numbers. There's very little stiffness when the numbers are in the negative zone there. Stiffness index is less than normal values corresponding with good condition of artery walls. So he's better than people his age at 50% here. He's negative 23.9. Excellent, excellent. We all want to be like that. I was looking through the literature because the next thing we're going to be looking at is vascular age. The vascular age of our smaller vessels. And so I found the calculations came from this guy, Takazawa, and here's a paper from him, Assessment of Vasoactive Agents and Vascular Aging by the second derivative of the PPG waveform. So anyway, this is the guy that came up with this calculation for vascular aging. So we have a patient who's 59 years old, and he's got the arteries, the smaller vessels of a 29-year-old. And this gentleman was certainly very, very happy. But his oxygen saturation wasn't very good. Now I'm trying to remember why that was, and he has sleep apnea. And that's probably some of the problem that you see right there. Yeah, and it says this value is typical for patients with cardiovascular and chronic pulmonary disease, but basically this is coming from the sleep apnea at 95.7%. I'll go over the normal values for you in just a minute. We're talking about oxygen saturation. We're talking about the hemoglobin that we're measuring. It's and that's what we're measuring is the value of which is determined by the pump function of the heart and the ability of the lung to saturate the blood with oxygen. So hemoglobin obviously is the oxygen carrying molecule to hold on to the oxygen, and that can be affected by iron deficiency anemia or microcytic anemia. And pH can have an effect. There's something in physiology we call it the Bohr curve. And if the blood pH goes too alkaline, that affects the hemoglobin's ability to release the oxygen to the tissues. It holds on to it too tightly. So there's some factors there when we talk about oxygen saturation. The normal value of oxygen saturation varies from 96 to 99%. A drop in hemoglobin oxygen saturation below 90 is considered as acute respiratory failure, and obviously pretty serious situation. To obtain a good assessment of blood oxygen saturation, perform the test several times over a period of time to see what the person's pattern is. We also get to measure the stress index, and this person, I can tell you, is under a lot of stress. And it should be normally about 150, should be the highest on the stress index. He's 200. So you can talk to them about what's going on in their life and what kind of things are stressing them. And this is similar to what we see in heart rate variability. Here are the stress index values, and let me go over those with you. Less than 50 indicates possible arrhythmias or artifacts caused by movement of the patient. 50 to 150 on the stress index level corresponds to normal values. 500 to 900 high levels of stress may be associated with severe psycho-emotional stress, prolonged stress situations, and health issues dealing with the cardiovascular system. Okay? When you finish your test, you know, there's different printouts. This is a conclusion that I like to look at, and it compares their measured values to the normal values. And you can just look in green because it's going to show you in green that what the normal values are. So his blood pressure is looking good. His you look over here, there's that negative 23.9%, and it tells you basically over here what that's about. And you can see it in green, so you know it's good, right? And he's much better than what it should be for his age here. It says for his age, a B pattern would be good. He's much better. He's a C pattern as far as the waveform. Less stiffness in the aorta. Vascular aging, obviously he's much better than where it says it should be. He's, what, 59 years old, so it said anywhere between 52 to 59 would be a normal reading for him. He's 29 years old. But the problem is, you can see in the red, you can start to see that the stress index, too much stress going on for this poor guy, and his oxygen saturation, probably because of the sleep apnea situation, you can see that in red here. Preparation for the Angioscan, very important. Testing should be done preferably at the same time. You know, that's even with the heart rate variability, advanced heart rate variability, if you could, it's not always practical to do it at the same time. You want the person to avoid smoking, caffeine, alcohol, and other stimulants. Intense physical activity should be avoided 1 day before testing with the Angioscan. Immediately before testing, it would be a good idea to have the client or patient relax in a comfortable, quiet area. You know, less stress, just let them relax for a little bit. The testing should be done either in the supine or seated position. The patient's hand should be placed at the heart level. If you perform the test in the seated position, all subsequent tests should be performed in the same position. Makes sense? When testing, place the optical sensor on the index of the right hand. There's several reasons why we sometimes don't get a good stable waveform, and cold hands, nail polish, acrylic nails, irregular heartbeat. Those are some of the reasons. When you're testing the person, you'll have this little screen come up. And to know that you have an accurate reading, you want to have this here. Let me go here. This should be over 1% for reliable testing. And this one here should be in the range between 4 to 60, which will be in the green zone. Both of them should be in the green zone somewhere. So that means you got an accurate reading. If you didn't, then like I said, a lot of these people, they have poor circulation, they have cold hands, and you can try and use different strategies to warm them up so you can get a good reading. You can attempt to warm the hands by rubbing them together. You could run hands under warm water, holding a cup of hot water and just having them hold their hands on that, using an instant hand warmer. So there's just some good strategies to use. Sometimes it's the nail polish, so you might want to remove the nail polish. But this machine is a little stronger than machines of its type as far as the way the infrared light works, and you can turn it a little bit, leave it on the normal way, but just turn it a little at a 45-degree angle, and sometimes it will get right through there for you, even if they have nail polish. But you could also remove the nail polish. You could place a probe on another finger. Final solution, shine the LED light from the underside of the fingertip. So you just flip it around on the bottom side and try and read it. And then if they have an irregular heartbeat, you might want to see if there is a period of a regular beat when you can get it. It's the same with the heart rate variability. It's, you don't want to be doing readings if they have it in a regular heartbeat. And you know, we say that a healthy aging requires a healthy arteries and a healthy heart. And so we have a solution for you for great prevention, and we have some solutions. So for natural proven solutions to improve the Angioscan readings, talk to one of our distributors. They have the information from some of the nutraceuticals that have been researched that really seem to change and turn these Angioscan readings around with again, the lifestyle changes as well. Thank you.